Welcome to The Deep Dive, the podcast where we sweat the small stuff so you don't have to. From real stories to expert advice, we're here to uncover everything about hyperhidrosis and empower you to take control. Ready to dive into the world of sweat and solutions? Let's make a splash.
All right, let's dive into sweat management and body odor. Specifically, we're going to be looking at Hyperhidrosis Awareness Kenya.
Okay.
They have all sorts of interesting stuff. We've got like program outlines, insights into like challenges men and women face, even treatments in Kenya. Like you might even learn about something called Hexel's hyperhidrosis. Have you ever heard of that?
No, I have not.
We're also going to look at how the dollar exchange rate impacts the cost over there. Interesting stuff.
Yeah, what I find fascinating is Hyperhidrosis Awareness Kenya is really like hands-on. I mean, like,
really?
They have this pilot program in Kibera where they're distributing these absorbent undergarments to people.
Yeah.
To help them manage the sweat.
I did not know that. I've always wondered why some people just sweat more than others. Is it genetic?
It can be. Hyperhidrosis is the medical term for it.
Okay.
And, it can be genetics, medical conditions, medications. But what's interesting is Hyperhidrosis Awareness Kenya really emphasizes the impact on teenagers and adolescents.
Oh, that's interesting.
Yeah.
Because, I mean, like teenagers are already self-conscious enough.
Right. Exactly.
Add in the sweating on top of that.
The social stigma can be brutal. And they're tackling that, not just the physical, but the mental and emotional as well.
Oh, wow.
Yeah.
So how does it impact their lives? Is it just, feeling sweaty, or is it more than that?
It's much deeper. Like, the material talks about people who avoid social gatherings.
Oh, gosh, yeah.
They can't do what they want in their career.
Yeah.
Even relationships are hard.
Because they're embarrassed.
Yeah, because of the shame and embarrassment. Yeah.
It's kind of heartbreaking that something like that can have such an impact.
It is. And it's different for men and women. Different across Kenya. Like young women, 18-24,
Okay.
They might be more sensitive to it because of social stuff and romantic relationship.
Yeah. Yeah, at that age, it's all about fitting in and all that.
Totally.
It's hard enough as it is.
Yeah. And for men in that same age, the sources point out that it's self-consciousness, Especially in things like sports or job interviews.
Oh, yeah?
Where you have to present yourself.
So different challenges, but still impactful.
Yes, exactly.
And it's not just young people, though, right?
No, not at all. Like, as you get older, there are different challenges.
Okay.
Like, for women in their late 20s and early 30s, it can be really tough balancing a career, family, and then managing the hyperhidrosis on top of that.
Just a lot to juggle.
It is, yeah. And then stress often makes it worse.
Oh, gosh, yeah. That's a vicious cycle.
It is. And for men that age, professional image is a big concern.
Yeah, for sure.
Like, it can be seen as unprofessional.
Totally.
In the workplace.
Yeah.
Or even hold you back from promotions.
Oh, gosh, yeah.
They actually cite a story of a man who was passed over for a promotion because his boss thought he couldn't handle the pressure.
Oh, wow.
Because he was sweating.
It's not fair to judge someone on something they can't control.
Exactly. And then hormones change with age too.
Yes.
And then you have other health concerns as you get older.
Right. So hyperhidrosis awareness. Kenya is really trying to look at how it affects people at all ages.
Yes.
And come up with solutions.
Yeah, they have some interesting interventions. Like, they propose comprehensive health education in schools.
Oh, that's great.
Yeah, so people learn about it early on. And they're promoting nutrition counseling.
So you can learn how diet affects your sweat.
Exactly.
Interesting.
Yeah. And they advocate for better access to treatment.
Okay, now you mentioned Hexel's hyperhidrosis before. What is that?
So that's excessive sweating.
Okay.
In the groin and buttocks area.
I did not even know there was a name for that.
Yeah. And you can imagine how that impacts your quality of life.
Oh, yeah, for sure.
Like, even just sitting or exercising can be,
embarrassing
and uncomfortable.
Yeah. Are there any specific treatments for that?
Yeah, some of the same ones for other types, like topical antiperspirants or Botox.
Oh, okay. Like those electric muscle stimulator thingies.
Right.
Is antiphoresis like that for your sweat glands?
Yeah, kind of.
Interesting.
Low-level electrical current.
So there are medical treatments, but is there anything people can do on their own?
Hyperhidrosis Awareness Kenya is really big on coping mechanisms, so like education, stress management, hygiene, and even self-care and building a support network.
So they really want to empower people to take control of their own condition.
Exactly.
I like that.
And they stress that professional help is important too.
Yeah.
If you need it. Better access to dermatologists and other specialists.
Now, you mentioned that they're looking at cost of treatments in Kenya.
Yeah, they have this thing they call a treatment index for hyperhidrosis.
Wow.
It lists all the different products available in Kenya with like user feedback.
Oh, wow, that's cool.
But they really look at the economics of it.
I would imagine cost is a huge barrier for people.
Yes, especially without good insurance. And they break down all these factors.
Okay, so like, what are we talking about here?
Well, the dollar exchange rate, for example. If the Kenyan shilling is weak against the dollar, it makes the treatments really expensive.
Yeah, import costs.
Right. Like an antiperspirant that's $10 here could cost almost 1,500 shillings there.
Wow.
After the exchange rate, VAT, all that.
I had no idea the dollar exchange rate could make that much of a difference.
It does.
Wow.
Then there's VAT, customs fees, shipping.
Yeah.
It all adds up. So even if it's available,
Yeah.
it could still be out of reach.
Too expensive.
Exactly. So hyperhidrosis awareness, Kenya is trying to change that.
Good for them.
You know, they want policies to make it more affordable.
Like what?
Like reducing the import tariffs on essential medical products.
So they really are taking a comprehensive approach.
Yeah.
Looking at every angle of this.
Yeah.
That's great. Now, we've talked about different genders and age groups, but I'm curious about the teenagers and adolescents, specifically in Kenya.
Yeah. So for them, it's really this social stigma and psychological distress.
Makes sense.
If you know you're already insecure
Oh, yeah.
at that age.
Oh, absolutely.
And then you add the sweating on top of it, it can be really isolating.
Kids can be so...
Right. And then there's social media on top of that.
It's another layer of pressure.
Totally. It's no wonder so many kids have self-esteem issues.
It's a lot.
It is. So it's great that Hyperhidrosis Awareness Kenya is working to create safe spaces for them.
So they can talk and get support.
Exactly. It's multi-pronged. Education, awareness, support systems.
All at once.
Yeah, they're trying to change the narrative
Yeah.
and help these kids feel good about themselves.
That's great.
Yeah. It's really great to see them being so proactive, you know, especially when you think about older adults in Kenya.
Right. Because we don't often think about their needs when it comes to this stuff.
Yeah. Like the sources mention that for older people, it gets even harder to manage because of, you know, their age, health conditions. Maybe they can't move around as well. And even simple things like bathing or changing clothes can be difficult.
Oh, yeah.
And that just makes the sweating worse.
I hadn't thought about that.
Yeah.
That makes sense.
So Hyperhidrosis Awareness Kenya is working to educate caregivers and healthcare providers on how to help them.
To make sure they're getting the care they need.
Exactly.
It's great that they're thinking about all this.
Yeah.
You know, the physical, but also the social and emotional at different ages. You mentioned earlier they're gathering data on treatment. I'd love to hear more about that.
So they have this sweat diagnosis unit.
Okay.
And it's basically like their central hub for understanding how things are being diagnosed and treated.
Oh, so they're looking at what doctors know.
Yeah.
And how they treat it.
Exactly. And they're comparing dermatologists to general physicians.
That's smart. Because you'd think dermatologists would know more.
Right.
But it's good to know if the general doctors know what to do too.
And that's what they're finding. Like dermatologists seem to be pretty knowledgeable, but general physicians, there's more variation.
Interesting.
Yeah. So your experience might be very different depending on who you see.
So you could go to a dermatologist.
Yeah.
And get one treatment.
Right.
But if you go to a general doctor, it could be totally different.
Exactly. And the sources actually talk about some patients who saw general doctors first.
Yeah.
And the doctor didn't really know the latest treatments or even misdiagnosed them.
Oh, wow. So you really have to advocate for yourself.
You do.
You know, if you think you have it, do your research, maybe ask for a referral to a dermatologist.
Yeah. It's important to be informed.
For sure. So what are some of the treatments available? What are people saying about them?
So that's where the treatment index comes in.
Right.
They list all these products available in Kenya, from simple stuff to more advanced.
Like a product review guide for sweat management.
Exactly. And it's really cool to see what works for people.
Yeah.
Like certain dry is really popular.
Oh, yeah, I've heard of that.
It gets great reviews for underarm sweating.
And there are other topical options too, right?
Yeah, Zero Sweat is another one. People like that it dries quickly and smells good.
Those little things matter.
Totally. Then there's Carpe and Sweat Block.
Okay.
Those are for hands and feet.
Really?
Mm-hmm. People say they're not greasy.
Okay.
And work really well.
So targeted.
Yeah.
What if you need something stronger?
Then there's Botox.
Okay.
Which can work really well. But you got to find a good doctor.
Right. You don't want just anyone doing that.
Exactly. And then there's iontophoresis. It's non-invasive.
Okay.
It uses a mild electric current to stop the sweat glands from working.
Like a little zap?
Yeah, kinda.
Doesn't hurt.
It's more like tingling or prickly.
Okay.
Not really painful. And then there's this newer thing, Miradery.
Okay.
It uses microwaves to get rid of sweat glands in your underarms.
Is that available in Kenya?
Not yet, unfortunately. It seems promising. But
Oh, that's a shame.
it is, yeah. But even with all these options, cost is still a big barrier.
Oh.
And hyperhidrosis awareness, Kenya really wants to change that.
Yeah.
They look at the economics of it.
We talked about the exchange rate.
Yeah, that's a huge factor.
All right.
VAT, customs fees,
Yeah.
shipping, they can really add up. And then manufacturer discounts
Right.
can be all over the place.
So it's hard to plan.
Exactly. So they're advocating for more affordable options.
Like what?
Lowering import tariffs,
Yeah.
maybe working with local manufacturers.
So they really are trying to make things better.
And it's great how they work with the community.
Oh, yeah. You mentioned that before.
Yeah. They know that the people affected are the ones who know best.
Right.
So they have focus groups, workshops.
Right.
They train converted health workers.
So smart. Using the community's knowledge.
Totally. It's much more sustainable that way.
And it shows that they're committed to making sure the solutions actually work
Exactly.
for the people who need them.
Yeah.
Now, you also mentioned raising awareness. What are they doing to address the stigma?
They're doing a lot. Public awareness campaigns with real people sharing their stories.
That's powerful.
It is. Showing you're not alone.
Breaking the silence.
Yeah. And they're educating healthcare professionals, teachers, community leaders.
To create a support system?
Exactly. And they're fighting for policies to protect people with hyperhidrosis.
Oh, wow.
So they're not discriminated against.
That's so important.
It is. Creating a more inclusive society.
I like how they focus on solutions that work in Kenya specifically.
Yeah. They get that something that works in one place
Yeah.
might not work somewhere else.
Right. Different cultures, different situations.
Exactly. So they partner with local manufacturers to make things affordable.
Oh, that's great.
Yeah. And they're even looking at traditional herbal remedies.
Wow. Blending old and new.
Yeah. And remember the exchange rate issue.
Oh, yeah.
They're trying to find solutions for that too. Like reducing reliance on imports,
Okay.
encouraging local production, even negotiating with manufacturers to get lower prices.
They really are tackling every angle.
They are.
It's really inspiring.
Yeah. It shows that even with limited resources,
Yeah.
you can still make a difference.
It's about being creative
Totally.
and finding solutions that work.
Exactly. And that comes back to empowering people to take control
Yeah.
of their health.
Just great. Wow, we covered a lot about sweat and body odor
You did.
and hyperhidrosis awareness. Kenya's doing amazing work.
Yeah, it's really impressive.
Really changing things.
They are. I think their dedication to community-based solutions is so important,
Yeah.
and making sure everything is culturally relevant. They're not just coming in with their own ideas.
Yeah, they're really listening.
Yeah. They're learning from the people they're trying to help.
I thought it was really interesting how they're using those traditional herbal remedies.
Yeah, me too. It's like combining the old ways with modern medicine.
It just shows that they get it. Healthcare isn't one size fits all.
Right.
There's more than one way to approach things.
Yeah.
And we have to respect that traditional knowledge.
Definitely.
And remember how we talked about the dollar exchange rate
Yeah.
affecting the cost of treatments? It's amazing how they're addressing that. Pushing for local production.
Yeah.
And even negotiating with those manufacturers.
It shows they're serious about making a real difference.
Not just talking about it.
Yeah.
They're taking action.
The thing that really stuck with me was their emphasis on prevention.
Oh, yeah, that's so important.
Not just dealing with it when it happens,
Right.
but trying to prevent it in the first place.
It's empowering people
Yeah.
to take control of their own health.
And it shows they understand that everything's connected.
Yeah, physical, emotional, mental.
Y'all linked.
Totally.
They're really changing how we think about healthcare.
They are.
Yeah.
And they're doing so much to create a better society for everyone.
Right.
It's not just about the individual.
Yeah, they're fighting stigma, promoting acceptance,
Yeah.
and advocating for those who are affected. Their work is really a great example of what can happen
Yeah.
when you have a community working together.
And compassion.
Yeah, definitely.
Even though we've learned so much today, there's still so much we don't know.
That's true. Research is always moving forward.
So it's really important for groups like Hyperhidrosis Awareness Kenya to keep going,
Absolutely.
to keep pushing for better treatments.
And support.
Yeah.
They're really paving the way.
For a future where this
Yeah.
isn't something to be ashamed of,
Right.
where we can talk about it openly
Exactly.
and manage it effectively.
I think that's a great goal to work towards.
So that wraps up our deep dive into sweat management and body odor.
It does.
With a special look at the work being done by Hyperhidrosis Awareness Kenya.
It was a really interesting discussion.
I hope everyone listening learned something.
I think so.
If you want to learn more about Hyperhidrosis Awareness Kenya, you can visit their website. It's hyperhidrosisawareness.kaok.
They have lots of information there.
Personal stories, treatment options, ways to get involved.
It's a great resource.
Remember, knowledge is power.
Absolutely.
The more we know, the better we can support everyone.
And create a more understanding community.
Thanks for joining us.
Yeah, thanks for listening.
Until next time, stay curious.
You've been listening to The Deep Dive because understanding sweat is the first step to thriving. Remember to subscribe, share, and connect with us on Hyperhidrosis Awareness Kenya socials. Together, we can stay cool, confident, and unstoppable. Until next time, keep shining. No sweat.